Now I am pregnant. Whoa. So what does that do to my body? How do I react to this pregnancy? How do I carry this pregnancy to term? And after 9 months, how do I take care of my baby? All this and more we're going to be talking about in this awesome antenatal stroke motherhood series on Nursing with Abby. Watch out. So you're welcome to this awesome motherhood series on Nursing with Abby. A first introduction, I am Nurse Abiodun. I'm a nurse, I'm a midwife, I'm a public health advocate, and I have a passion for what I do. And on this channel, we talk about nursing, lifestyle, and everything in between. So now everything in between includes antenatal care and motherhood. Yes, a lot of women in the house say, yeah, okay, yes. So I have my audience. So today, I'm going to be giving you a brief introduction on why motherhood series, because we've been talking about a lot of things about nursing, how to be a nurse, and all that in my previous videos. But today, and for the next 6 months, I guess, yes, for the next 6 months, I'm going to be coming to your faces twice in a week. And I'm going to be talking about antenatal care, I'm going to be talking about motherhood, I'm going to be talking about parenting. So it's going to be a whole full package. So please do well to make sure you like, share, and subscribe. I'd like to thank all of my subscribers for always supporting this channel. I am so grateful. And for those of you who are just seeing my face for the first time, I am Nurse Abiodun. Like I said, I talk about nursing lifestyle and everything in between. So you're welcome. Please do me a favor, like. Another favor, share. And the last favor, please subscribe. And one more, please. Please make sure you drop your comments. I'd love to hear from you. Okay, so right into what we want to do today. I'm going to be talking about 3 things today. Just 3. Because I don't want to be wasting much of our time. I'm going to be talking about a brief introduction into why this motherhood series. I'm going to be talking about why my body has to change. And I'm going to be talking about implantation bleeding. Have you heard that before? Don't worry, I'm going to break it down. So, first, why did I decide on this motherhood series? Now, looking back at a few months, like almost a year or 2 years now, we've had COVID, a lot of people had to stay at home, a lot of people got pregnant, and a lot of people didn't know what they had to do during the period of pregnancy and how they could take very good care of themselves. And unfortunately, even till now, a lot of skeletal activities are just still going on in the hospitals, and people are still trying to make sure that you still stay at home, you still stay away from a crowd and a lot of people where you get antenatal clinics and all that. So a lot of people are deficient in the actual knowledge, or even some people know and they probably forgotten. Maybe this is their 3rd pregnancy or the 4th or the 5th or the 6th. So I just try to bring up this channel, this series, to bridge the gap of the knowledge that mothers need even at this critical period. It's critical, it's beautiful, it's awesome being pregnant, but it's also important to be prepared. And that is why I'm taking us across this series. It's going to run for 6 months, like I said. It's going to be twice every week, so be sure to stay tuned. I'm going to make sure it's going to be short, precise, and understandable. That is the big deal. I need you to understand me, so I'm going to come straight down to the level that you would understand. Okay, so today I'm going to be talking about why my body has to change. Why do I have to change when I'm pregnant? Okay, now we know that it's the coming together of a man and a woman in sexual relationship that could bring about a baby. Not all sex relationship brings about a baby, but it is important that you know that the period of your fertility was when you and your husband or your spouse or your partner came together and he deposited his man egg, which is sperm, into your own woman egg, which is the ovum. And then there was the fertilization. Fertilization just means coming together, okay? And then the fertilization brought about the growth of that tiny individual, which was previously a clump of cells, like blood coming together, and then gradually it starts to form, and then it starts to form, and then it starts to form, and the tummy starts to bulge, and then people say you're pregnant. But what are the first things that happens when that fertilization occurs? Initially, a lot of people don't even know when they actually got when they conceived their baby. They don't know the exact day. You could just have an idea of maybe the 14th day before my next menstrual period, I had sex with my partner or something like that, but you don't really know the actual time. All those rudiments are left for the scientist. But most importantly, after the fertilization occurs and the clump of cells start forming together, there are some hormones that are being released by your body system called estrogen. And those hormones are estrogen at one time progesterone. So we have the two of them working pari passu. So now, the two hormones that are actually working together are what affect every part of your body. Read my lips. Every part of your body. Now, there is no part of your body that does not understand and realize that you're pregnant. The mothers know about what I'm saying. Now, so every part of your body recognizes the presence of these hormones that are produced in large quantities. And why are they produced? To help to develop those clump of cells into a baby, into a forming baby in your womb. So when those hormones come out to your body, that's when you do a test, maybe a urine test or a blood test, and they're looking for the reaction of your body to those hormones. And then they will say, go and do a urine test, go and do a blood test to show that, pregnancy test to show that you're actually pregnant, or your pregnancy test shows positive. That's one. Then all other parts of your body also takes a toll. The hormones takes a toll on those other parts of your body. For example, you might start feeling nauseated. You might start feeling the need to just be weak and drowsy. You just feel a bit sleepy. You just feel like, because those hormones are they're called relaxing hormones. Just understand that they are relaxing hormones. So they just make you feel dizzy and sleepy and weary and tired. It's just a way of reducing the stress of the outer body so that the inner body starts working to help you form your baby. That's it. Yes, it's not everybody that has symptoms, but those that do have symptoms, these are the results of the symptoms. Now, sometimes you feel like you want to vomit, you don't feel like eating, everything nauseates you. Those are the effects of the hormones. Sometimes you just feel like, your body feels tender, you feel a bit cranky, you feel quite away from people. You feel a bit less of yourself, sort of. Okay, because of the hormones. Those are what it does to you. Now, there are different effects for different people, but this is just a general effect that I'm trying to talk about. So that is why my body has to change, because of the hormones, estrogen and progesterone. So they are just the relaxing hormones. They're just going to make you feel sleepy and weary and dizzy, and you don't really, you are not so active as before. Like I said, it's not everyone, but for a cross section of a large number of women, this is what happens to them. Now, implantation bleeding. Now, some people would ask me, can I still, bleed when I'm pregnant? After, being confirmed that I'm pregnant, can I still bleed? Yes, it is possible in some cases. And that is natural, actually. But it doesn't happen to all women. Now, implantation bleeding is this. Now, your womb is like a cup. Yes, it's just like a cup. And then your baby just wants to attach on that womb. Yes, that's your uterus, your womb, where the baby should stay and grow. So as the baby is trying to burrow, let me call it like the baby is trying to attach well to the inner lining of your uterus, there could be some shedding of blood coming down like that. And that shedding is what we call implantation bleeding. Now, characteristics of implantation bleeding is that it should not be much. It should just be a few trickles of blood, and it does sometimes occur weeks after your conception, when the fertilization has occurred. So it's just what happens after the fertilization has occurred, and then your baby is trying to implant into the inner lining of your womb. Now, number one, like I said, the blood should not be much. It should just be like traces of blood staining your pants, and it could be a bit painful, but it should be a bit discomforting. Let me put it that way. Pardon me for that. Discomforting, but it should not be painful. Now, anytime you notice pain, severe pain like that, if you notice severe much bleeding, then find your way to the hospital. That is more than implantation bleeding. So I've explained why it happened. Your baby is just trying to attach to the wall of your uterus. Now, after that, we expect that within a few days, maybe like 2-3 days maximum, we expect that it should stop. So if it continues for 4 days, 5 days, and you need to see a doctor. Remember, it should be scanty, very small. It should not be like your normal menstruation of 3 days, okay? And then it should not be so painful. Yes, it should not be painful. Yeah, those are the three. So I told you I'm gonna make sure that my videos are short so that you can have a lot of time to keep watching them and understanding them. So today, in conclusion, I'll just like to recap what I said. I gave you an introduction into this motherhood series, and I explained what pregnancy does to your body because of the effect of those hormones called estrogen and progesterone. Yes, very good student you are. And the third one is implantation bleeding. What is it? Why does it happen? And when do you need to see a doctor if it's more? So I'm gonna see you in the next 3 days with another exciting episode of this motherhood series. Please make sure you join me at that time so that we can dig together and we can learn about ourselves and our pregnancy together. Remember, my name is Abiodun, and this is Nursing with Abby, where I talk about nursing, lifestyle, and everything in between. So see you next episode. For now, it's bye for now.